Okay. Wonderful. I think I can see everybody. It's lovely with 141 participants and our panelists. Can you all hear me?
Yes.
Great. Okay, so dear participants, my name is Nora Teller and I'm one of the members of the European Observatory on Homelessness. May I share some technical information with you ahead of our webinar? The presentations and the Q&A session will be recorded and made available on the website of FANTA and the European Observatory of Homelessness, and now it's being live streamed as well. We will circulate the link to the video after the event. I would like to encourage you to direct your questions and comments to the speakers in the chat box, which is on the right-hand side of the Zoom interface. Please address specifically the person whom you would like to ask. We are three moderators: Freek Spinneveen, the director of FANTA, Volker Busch-Gertema, the coordinator of the observatory, and I will be collecting your questions. So since there will be limited time to respond, we would like to ask you for your understanding if your question cannot be answered. May I now ask Marco Lazzari, the head of the Department of Human and Social Sciences at the University of Bergamo, he's our host, and at the same time, chair of the webinar, to open the event. Thank you so much.
Thank you, Nora. Good afternoon. Hello, everyone. Dear friends of FIANSA and of the European Observatory in Homelessness, distinguished speakers, esteemed guests, on behalf of the rector of the University of Bergamo, it is my pleasure and honor to extend a gracious and grateful welcome to all the people who are here to attend the webinar COVID-19 and homelessness. I said we are here, and unfortunately I intend online. As most of you already know, today we had to open the 15th European Research Conference on Homelessness. We had received plenty of interesting abstracts of researchers who are willing to share their ideas with us, hosted in the conference rooms of the University of Bergamo. I think that you can see our Aula Magna on the background of my Zoom screen. Unfortunately, as soon as we realized in March that our town had been so strongly hit by the virus, we decided to postpone the conference to next year. Even more sadly, 6 months later, we see that many countries nowadays are suffering even more painfully. I do hope that we can all be here next year. The virus will be just a bad memory. The event is rescheduled for the last week of September next year. But for now, we can only see each other online. The problem of homelessness has been made even more important and significant by the health emergency we are experiencing in these times. And it's for this reason that we have decided to meet today, to symbolically remind us that we should have been here for the conference, but also to hear three authoritative voices on the subject. That's why we are here virtually. It's a kind of mocking fate. The European Observatory on Homelessness does not find a fixed abode for its conference. It's a homeless conference. Anyhow, the University of Bergamo is really happy to host this event, and we are grateful to FIANSA for choosing us. And now I think that it is the time for me to declare open the webinar. And the first speaker is Ruth Owen. Ruth is the Deputy Director of FIANSA, and her task is to co-plan and coordinate FIANSA's policy work. She works on EU social policies, housing and monitoring homelessness. She has been with FIANSA for 10 years now. Ruth, I remind you your 20 minutes. Thank you.
Thank you, Marco. And yeah, I think we're all very disappointed not to be with you in Bergamo today. I will do my best to be an authoritative voice on this subject, although it feels like early days for any of us to be very authoritative voices on the impact of the pandemic on homeless people. I'm just struggling to open my PowerPoint at the beginning, but I think we're getting there. Okay, so I'm going to share some insights with you from the monitoring work that FIANSA has done so far on the impact of COVID-19 on homeless people. And this is monitoring that is based on inputs from our members, mostly social service providers working with homeless people around Europe, our broader network, media, research and policy literature. And we've been looking at the impact of the pandemic on homeless people, on homeless services, as well as the policy responses. And I'd like to say a big thank you to Miriam Mattison, who was until recently a policy assistant at FIANSA and who was very involved in coordinating this monitoring work. So my PowerPoint will look, my presentation will look very briefly at preparedness for the pandemic from a homelessness point of view, lockdown, what happens next, and some tentative conclusions. So I don't think it's a scoop that most European countries were underprepared for a pandemic of this type, and especially from the point of view of medically and socially vulnerable populations like homeless people. That said, some public authorities and agencies sort of stood out for using the short window at the outset of the pandemic to come up with targeted plans to protect homeless people. I think good examples in that respect would be France, Dublin, London. Guidance from public health bodies was rather lacking. I mean, this is a new disease, and both the European Centre for Disease Prevention and Control and the WHO have yet to issue specific guidance on COVID-19 and homeless populations. Several national regional bodies have issued sector-specific guidance that's been useful, but I think the theory to practice gap is quite significant, and some of the guidance struggles to take really account of the operational reality in homeless services. So what happened during lockdown? Lockdown made homelessness pretty much impossible to ignore. I mean, you can't stay home if you don't have one. And that meant that measures to protect homeless people and or limit their role in transmission were introduced in most countries. There were 6 main areas of intervention: new temporary accommodation, adapting existing accommodation, public health outreach, social support, food and hygiene, and prevention. So I think probably the most dramatic development in terms of the response to COVID-19 from a homelessness perspective was that housing or accommodating homeless people became an urgent public health priority almost overnight, and we saw unprecedented efforts on the part of some public authorities in Europe, often working very closely with the homeless sector to undertake that task. And there were some kind of bold and creative measures to mobilize self-contained units very quickly. That included hotels, tourist flats, social and private housing, public buildings, student housing. And some examples, in the UK, a program called Everyone In brought 15,000 people who were sleeping rough or in night shelters or at risk of those situations into hotels, bed and breakfasts, social housing and other settings. Basically, over a few days, there was a letter from central government sent to local authorities asking them to do this, and then some guidance and funding provided to help them do it. In Brussels, 700 homeless people have been accommodated in 11 hotels with a kind of package of social support. 2 special centres have been established to care for homeless people with COVID-19, and an extra €7 million has been put into protecting homeless people in the context of the pandemic. In Prague, 300 homeless people are being accommodated in hotels and tourist hostels, with plans to maintain that until at least March 2021, and quite an extensive social support offer in place. I mean, that's really new for a city like Prague that didn't really have a developed supported housing offer. France had a huge mobilization and created about 21,000 extra places in shelter, about half of them in hotels, and almost 100 regional kind of specialized centers to temporarily house and care for homeless people with COVID-19. They injected about €50 million into the homelessness response. And in Dublin, all rough sleepers were offered accommodation by June, and 500 vulnerable homeless people were placed in shielding, which is a kind of maximum isolation because of vulnerability. About 340 of those were in new housing or temporary accommodation units, and 120 people were moved from high occupancy units to new reduced occupancy accommodation. I don't have time to talk through these, but these are just some images of the kind of new settings that were mobilized very quickly during the lockdown period. So in terms of existing homelessness accommodation, there was definitely a tension between maintaining access to shelter and accommodation services and protecting clients and staff from shared airspace and high occupancy settings, with particular worry about dormitories, shared bathrooms, dining rooms, and shared cooking facilities. Some accommodation closed, but in most places capacity was overall boosted. Winter programs were prolonged in many countries to keep shelters open, and additional places were created to reduce occupancy. There were a whole range of operational measures to reorganize services to facilitate distancing and isolation. A lot of information and hygiene measures introduced. As I mentioned earlier, some sector-specific guidance from public health authorities, like Public Health England issued guidance for hostels, but it was sometimes difficult to apply. Like, it said things like, stay in your room as much as possible if you have symptoms, but if you're living in a place with a shared kitchen and a shared bathroom, that's pretty difficult. Access to protective equipment was a major issue for the homeless sector in most European countries. And one positive development in relation to existing accommodation was an easing of access for vulnerable groups. So, for example, barriers were lifted for mobile EU citizens and migrants with precarious legal status in the Netherlands and the UK, just in the interest of sort of bringing everybody in. In terms of public health outreach, there was, clearly a strong case for prioritizing the testing of homeless people as a vulnerable group in the context of the pandemic, but the overall shortage of testing made that pretty difficult in practice in most places. There were some good practices. Brussels, Dublin, and Porto were all cities where specialized GP services provided testing in homeless services. In Budapest, all residents and staff in municipal homeless accommodation were tested, and in London and Copenhagen, existing mobile testing units for TB that usually work with homeless people were mobilized to test for COVID-19. I think that the places where real public health strategies targeting homeless people were introduced were quite few and far between. London gives some interesting lessons. There was this cohorting approach with a swift procurement of safe accommodation in hotels and wraparound and specialist support, separating people who were symptomatic or tested positive from people who hadn't. And there was a kind of reinforcement of cooperation between the Greater London Authority, the National Health Service and the homeless sector. And a lot of that was inspired by really advocacy work in the form of a plan called the Triage Test Cohort Care Homeless Sector Plan, which was developed by Dr. Al Story and Professor Andrew Haywood, who are homeless health and health inclusion specialists working at University College of London. And they developed this kind of best possible plan as a tool to advocate for a proper public health strategy towards homeless people during this pandemic. And it certainly influenced the response, and I think it's a good case study. In Dublin, there was a swift public health response. This was coordinated by the health executive, and it involved specialised GPs, harm reduction services, and the homeless executive. They appointed a specific clinical lead on COVID-19 for homelessness, Dr. Austin O'Carroll, and there was a very strong harm reduction approach. So they recognised that substance use is a major barrier to following the public health guidance in the context of the pandemic, and therefore improved access to methadone treatment. I think waiting times fell from more than 3 months to 3 days in Dublin, and improved things like the home delivery of prescription drugs as part of supporting homeless people who were self-isolating. Access to social support, there's no doubt that the kind of support services, outreach services and ambulance support services came under great pressure during lockdown. There were the same issues that all organisations were facing: workforce issues, challenges around distancing, and the overall reorganisation of the sector and the broader local service network. Outreach services to rough sleepers played a very difficult but very important role during lockdown. The availability and the quality of social and health support in these new temporary accommodation settings was absolutely critical, especially for very vulnerable cohorts. So when you suddenly had hundreds of homeless people in hotels, they needed proper social work and health support. Otherwise, those settings didn't really work out. The transition out of lockdown implies an important role for these support services going forward to facilitate move on from these settings. And we saw some innovation in terms of the switch to video and telephone support systems for case management, like in Housing First programs in Spain. So access to food and hygiene was a real worry for homeless people during the pandemic, and the services that deal with that, like day centres, showers, food distribution, were very heavily impacted, partly because they rely a lot on volunteers. So again, there was a big reorganisation of services, things like moving from hot meals to takeaway or to voucher schemes, the distribution of hygiene kits and food. And we saw a kind of centralisation of services to compensate for closures. For example, that was very much the case in Brussels, where lots of the voluntary sector services were closed. So a public swimming pool was open to provide showers, and a youth hostel was converted into a day centre. In terms of prevention, clearly, general welfare systems in Europe have played, are still playing a very important role. And there have been massive efforts to secure incomes and manage short-term unemployment. Prevention of evictions has been a big priority, and we've seen the widespread suspension of evictions temporarily. Some countries and regions have already prolonged these measures. Many are fading out, and it's uncertain what's going to happen in the medium and long term. There's a very serious threat of a big upturn in evictions. Even with the suspension measures, we're not addressing the accumulation of arrears or the increase in illegal evictions in some contexts. And an important aspect of prevention during lockdown was blocking established pathways into homelessness. So, for example, the UK suspended evictions from asylum centres and provided additional funding for support and accommodation for prison leavers, although those measures are already being phased out. So were homeless people protected? It's really too early to say. The picture across Europe is very incomplete. There is evidence in some places that the infection rates amongst the homeless population were lower than expected, for example, in Dublin and in England. Some homeless services definitely became clusters for infection, but we're unable to map that comprehensively. We have the least information about the countries with the lowest quality services, and we need a more robust assessment of infection levels amongst homeless people and their outcomes going forward. Just to zoom in a little bit on one place where some analysis has been done about the effectiveness of the measures is in England and the UCL Collaborative Centre for Inclusion Health, where they have done some work, Dr. Al Story and Professor Andrew Haywood, around comparing the high attack rates in communal US shelters where outbreaks occurred with 0 outbreaks in single room own bathroom facilities in London. And they show fairly convincingly that the closure of shared airspace hostels in London and the replacement with safe alternative accommodation worked, whereas the attempts to COVID-proof communal shelters in US cities were less successful. It'll be interesting to see what Dennis says about that. And just this week, they published a new study, a modelling study looking at the impact of the protective measures on the whole homeless population in England, and found that these measures avoided 266 deaths, as well as a lot of infections, admissions, and ICU admissions. So there does seem to be some quite strong evidence that the protective measures and the non-recourse to communal shelter settings does seem to have protected homeless people to some extent. This graph shows what happened in Dublin. It's taken from Dr. Austin O'Carroll's work. Things, again, much better than expected. 63 cases and 1 death by June 2020. So what's going to happen now? Lockdown has eased in much of Europe since April, but restrictive measures are being reintroduced because of the current rise in cases. The future of homeless people who are temporarily accommodated during lockdown looks very uncertain. There are some places where we're seeing very promising policy announcements in terms of COVID, maybe becoming a turning point in the way that we deal with homelessness. I think the Netherlands is a very good example. They've decided to invest 200 million euros in housing and accommodation for the homeless in the next 2 years. They want to create 10,000 new supported housing units, increase prevention, and completely transform the shelter sector to get rid of shared airspaces, basically. So they want to really shift to a housing-based response and for no one to stay longer than 3 months in shelter. Lyon, the city of Lyon in France, has committed to 0 returns to the street and has a plan to mobilize 500 housing units to deliver on that. And similar measures in a range of places. I'm getting a bit short on time, so I won't go into them all. In terms of next steps, it looks likely that we'll see an increase in homelessness, and we need some strong prevention policies going forward. I think researchers, advocates, the homeless sector should be making the case now for COVID-19 as an opportunity to build back better on homelessness policies, and recovery programs offer a real opportunity to invest both political will and resources, money, into better homelessness policies, specifically prevention, rapid response in the form of affordable housing with accompanying health and social support, And now that homelessness is firmly on public health agendas, can we do better in mobilizing
A couple of minutes.
health budgets? Sorry?
2 minutes.
Okay, perfect. So in conclusion, we definitely need better pandemic planning for homeless people as a vulnerable group. 5 things that proved essential to keeping homeless people safe were political will and resources, access to safe and dignified accommodation, access to social support, to healthcare and prevention. They're basically the same things we needed before the pandemic. The urgency is what's new, and the challenge now is to maintain that and try to make COVID-19 a turning point. I think the pandemic is confirming things we already knew. Housing is a social determinant of health. Traditional night shelter is an inadequate response to homelessness. Dignified, safe, sustainable exits from homelessness require housing. And some homeless people need additional social and health support, some of them for a long time. The pandemic's definitely not over. The winter looks quite frightening from the perspective of homeless people, and we should at least be seeking to maintain and expand protective measures that have worked so far. And I think 2 important tests of public policy response going forward will be, do they provide sustainable solutions to people who were temporarily accommodated during lockdown, and do they address new inflow into homelessness? And I think those would be 2 interesting questions for a policy relevant international research agenda in the next year. So thank you, and I look forward to the other presentations and to the questions and discussion.
Thank you very much, Ruth, for your speech. I remind the attendees that they can use the chat for their questions, which will be sent to the speakers for the final question and answers session. Now I'm going to hand over the microphone to the second speaker, Dennis Colham. Dennis is a social science researcher at the University of Pennsylvania with primary expertise in the area of homelessness and assisted housing policy. His work has contributed to efforts to address the housing and support needs of people experiencing housing emergencies and long-term homelessness. He has a leading role in making use of administrative data to have a better understanding of homelessness. Please, Dennis, it's up to you.
Okay, and can you see my screen, folks? You seeing my slides?
Yes, but it's, yeah, so please press that one. Great.
Okay.
Perfect.
All right. Thank you. Thanks, Marco, and thanks, Ruth, for those comments. I think the U.S. situation parallels the European situation in some ways. As some people may know, because of the extent of the crisis in the U.S., the response has been quite fragmented. The typical kind of federal leadership we might have expected has not emerged. And, you know, given the varied responses, I think we do face an uncertain future going forward as to what we can expect could be, even within the pandemic period still, what might yet evolve. A context, I think, for understanding, you know, when the pandemic emerged in the US, we already had some significant crises facing the homelessness sector and the population. Key among these is the aging of the homeless adult population on an accelerated basis relative to the US population. We already had high and rising rates of unsheltered homelessness, especially on the West Coast. And if you combine the elderly plus people with comorbid conditions, you got anywhere from 40 to 60% of the homeless population is in a category that could be considered at high risk. The aging problem is illustrated by this graph. It's the 3 decennial censuses in the US from 1990 in light blue, 2000 in orange, and 2010 in dark blue, basically illustrating we have this cohort effect of people born between 1955 and 65 having been the dominant homeless population in the US for the last 35 years. And that's continuing. And the peak age right now is age 60, people between 55 and 65 primarily. And so we're expecting to see a tripling in the elderly homeless population, people over 65, over the next 10 years. So obviously a very high risk group with comorbid complication risk for COVID. The unsheltered population has also been growing. The yellow line in this chart, as you can see, going from 2014 out to 2019, we had a 71% increase in unsheltered homelessness among adults, non-chronic homeless adults. So that really is reflecting the dynamic that we're seeing on the West Coast that has led to such a dramatic experience of to the public and to people who are homeless in unsheltered homelessness out there. In March, with some colleagues, we tried to do some quick projections of what might be needed to provide appropriate accommodation for not only people in shelter but unsheltered. And essentially, we estimated that with reducing the density of existing congregate shelters, we would be at a loss of 100,000 beds in the inventory that would have to be made up for. We estimate the annual homeless assessment report puts the number of unsheltered at about 211,000. We think that represents a 40% undercount, so likely as many as 300,000, of which if you only were to try to shelter the people at high comorbid risk, you might do 180,000. But the bottom line is that we estimated somewhere between 280 and 400,000 beds would be needed at a cost of $11.5 billion. We didn't really specify that what kind of beds these would be at that point. We were just trying to come up with a quick estimate. So a few researchers have joined up with the National Alliance to End Homelessness. We've been surveying local homeless authorities about how they've been responding. And here's just a few highlights from that. 85% of our local authorities have said they're placing people in hotels and motels, both people who are tested positive and those who have the comorbid risk factors. 30% of our communities say they've closed shelters, 38% open shelters. We do not have bed numbers and will not have them until January when they're reported. So we don't know. Our federal agency, our housing agency, HUD, has not requested a day to be reported to them in a more timely fashion. So we don't actually know what the impact has been on bed supply. Communities are saying they're locating new permanent housing units. 40% are exiting hotel residents to housing, but 28% are reporting that they're exiting folks to homelessness, and 30% unknown. An interesting dynamic that has emerged is a lot of communities now see these hotels and motels as an inventory that they could acquire and potentially convert to housing, or as more private accommodation shelter. So that's what's going on. The major challenges that showed up from the survey, there is just no coordinated testing strategy. It's just hit or miss. Some communities have a connection with their health departments, and there's a organized testing strategy in the shelter system, but many of them there is not. There might be, people have to go to designated outdoor locations potentially for testing, but the results are not necessarily being reported back to the homeless assistance programs. So it's kind of all over the place. Protective equipment has been very much an issue, both for staff and clients. There's a worker shortage in direct care staff. That's one of the highest needs that was reported by communities. Some places reporting an increase in unsheltered homelessness. And a big sort of looming issue out there is because of the decline in tax collection with the shutdown in commerce, our state and local governments have significant revenue shortfalls, and this could have a long-term impact over the next several years in terms of how these governments can respond to needs in the future. Our federal government response initially was driven by the Federal Emergency Management Agency, or FEMA. They are continuing to pay for these hotel placements at 75% of the rate, but only for a 90-day period. There was the emergency legislation, the CARES Act. It included a homelessness-specific funding provision called the Emergency Solutions Grant Program, which was funded at $4 billion for prevention, rapid rehousing, and rent assistance. I'll note, just to put that in context, about the total federal appropriation for non-veteran homelessness is $2.5 billion. So just to give you a sense, it's almost double what our government would spend in a year on overall homeless assistance, not just in this one program. The funds can be spent through 922, which is important. So a lot of communities are using this ESG money to get people into, coming out of hotels potentially, or directly off the streets, straight into apartments, and they can pay commitments of rent for up to 2 years in some cases, which I think is having a big impact out there. Although again, we don't have a data capture right now and report that's telling us what's happening on the ground. The National Alliance to End Homelessness has really spoken out against using these ESG funds for prevention, because at a local level, of course, there's many households that are stretched in need, feel like they're threatened with eviction and they're in arrearages. And so this pot of money could easily get spent quickly on people who are at risk of homelessness, but not yet homeless. And so the Alliance is really urging communities this is the resource that's supposed to be dedicated to people who are literally homeless and to get them out of homelessness. But there is a tension there. And as you can imagine, at a local level, there's political pressure on local electeds to spend that money on housed populations at risk. We had a recent announcement, a lot of the national moratorium on evictions was ending, and the CDC actually stepped up to extend this. I don't recall ever the CDC stepping in with a national housing policy of this sort. There are exceptions. It doesn't cover everyone, but at least through the end of this year, there's supposed to be a continued national moratorium on evictions. And just note that many states have barred utility companies from shutting off services. Normally, we're in the season now where utilities would be shutting people off for non-payment, and that is not happening because most states are preventing it, but non-payment rates have doubled. So this is another looming problem out there for people in housing. Of course, we've had a co-occurring phenomenon here in the US, this reckoning Black Lives Matter movement against systemic racism. It has been occurring at the same time within the homelessness field. There's been more talk about racial disproportionality in homelessness. The evidence has been there for decades, and it's kind of surprising that, it's only been in the last 2 years that people have decided that this is something that they should be talking about. But at least in the US context, there's in the homelessness sector, there's been more focus on that disproportionality. And of course, the COVID and recession impacts are especially impacting Black and Latinx communities. We have also seen that housing crowding is a major vector for contagion, and one of the reasons that Latino and Black households have seen higher rates of infection. Also, these are folks who work in direct service employment and they rely on public transit, so they're more likely to be exposed in their work and transportation. And they have high comorbidity rates with all these risk factors because of poor health and poor access to healthcare that are associated with, structural poverty and systemic racism. The street protests around the country have, as you may well have read, are pretty routine. Here in Philadelphia, I think we had protests almost every day from the end of May until early August. It wasn't until mid-August that there seemed to be some days when there were not protests going on of some sort. And they have been calling out the issue of homelessness, and they're using the term unhoused, which I know would be of interest to the homeless academic audience, because they're basically rejecting the homeless label. It has, over time, of course, every term can become stigmatized. And so but also unhoused is much more concrete and specific to the nature of the problem. And so these are folks who don't come from an experience of homeless advocacy or research, but it's interesting that this has sort of become the parlance of the moment. So I guess the question, and this goes to Ruth's comments also, you know, will this mark a turning point? We have had for the first time open discussion by national advocates that congregate shelters are not appropriate for this population. And we are a system that's dominated by congregate shelter, which has long accepted that these sort of Dickensian institutions, poorhouses, are somehow an appropriate social welfare response. And then, you know, is instead this hotels with 90-day stays where people can be found. The other great thing about people being in hotels is case managers can find people, healthcare workers can visit them. People have a relaxation of all of the anxieties that they're experiencing when they're not in a private dwelling. And people report it's far easier to work with people when they're in a private accommodation to transition them to housing. So, you know, is this the new model that we should be holding up as the standard? And you know, rejecting the chaos that results from the nighttime only congregate shelter system. Another thing that's happened, I think that because the aging homeless have this higher comorbid risk, many local authorities are much more aware of the elderly homeless problem that is growing in the States. And I think that's important. You know, there is increasing support for minimum income programs in the general population through, you know, part of the emergency response of the federal government was to give people cash. And this is something that in the US social welfare world would never have been thought to be broadly popular because there's such a stigma associated with providing direct cash assistance to people who are of low income. But at the same time, I think there's growing recognition that, you know, income is like as essential as, you know, clean water and clean air to survive, and that some basic income is what would enable people to not have to dig through trash, beg on the streets, and have to go to facilities just to get food or basic necessities. And I think it's an opportunity to advance that important argument as well. In the health sector, you know, we've had a lot of talk over the last 5 years or so about social determinants of health. There's a lot of you know, physicians, healthcare organizations and providers, and even the health insurance companies who are saying we're focused on, you know, not just health, but the social determinants of health, because that's what's driving, you know, unnecessary and expensive cost and premature mortality. And, you know, the unhoused are part of the target population they're focusing on. And we're seeing much more explicit discussion about coordinating health and housing needs by these healthcare organizations. So they are a different sector than the homeless sector. They bring a whole different perspective, and they have access to, you know, more funding. And it will be interesting to see. There are some cities where you're seeing they're playing a much larger role than they would have previously in trying to help resolve people's homelessness as a way of addressing their health risks. But as I mentioned earlier, I think the looming problem out there is that a lot of deficit spending has been going on by states and borrowing anyway, and by the federal government, and that the recession and contraction in revenue could mean that we will see a reversal of any progress that we might hope to make, and that the opportunity for using this as a moment for change could disappear under those pressures. So I'll just leave it there. Thank you very much.
Thank you. Thank you, Dennis, for your speech. I remind the attendees that the presentations and the Q&A session will be made available on the website of FIANSA, and we will circulate the link to the video after the event. And now the third and last speaker is Steve Gates. Steve is a leading scholar on homelessness and is director of the Canadian Observatory on Homelessness at York University. He focuses his efforts on conducting research and mobilizing this knowledge so as to have a greater impact on solutions to homelessness. Steve has played a leading international role in knowledge mobilization and homelessness research through the Homeless Hub. 3 years ago, he was awarded the Member of the Order of Canada. Thank you, Steve.
Thank you. I just want to say the past two presentations were quite interesting and very powerful. It's interesting because there, as one might expect, there is some parallels with what's been happening in Canada, but also some things that are perhaps unique. So I'm going to, let's see, this, have to make sure I have the right presentation here. Okay. So, as you, from the title, I'm going to talk specifically about COVID-19 and homelessness and what are the implications for Canada, both in terms of the present tense, but also going forward. Just a very brief background about Canada. We have a population of 37 million. Our government is organized, it's a federal model of government, but it's complex in that the middle level of government, provinces and territories, have constitutionally a responsibility for a lot of institutions and systems that impact on homelessness, like healthcare, child protection, education. It goes on and on. In Canada, we don't have recent estimates, but in the past we've estimated that in a given year, about 230,000 people experience homelessness annually, people that actually touch the system. So the actual incidence is probably higher than that. And that means 35 to 40,000 on a given night. In Canada, up to this is as of this week, we had 143,000 cases of COVID-19 and 9,000 deaths. Okay. So in the presentation going forward, I'm going to talk about different orders of government, the federal government response. I'm going to talk about municipalities, and then a bit on the ground, like from the service provider perspective, what's happening, and then conclude with what's next. So in terms of the federal response, Government of Canada has done a number of things that in response to homelessness, turned on the taps of spending a lot. They instituted a system of income support for people who are now find themselves without work because of the pandemic. That is coming to a close soon to be converted, retooled into our unemployment support system. They increased federal investment in supports for emergency services for the homeless sector to the tune of 157 million earlier this year. In different jurisdictions, there are moratoriums on evictions, just as Dennis, you mentioned in the United States. Also, in terms of discharging people from child protection as well. So one of the interesting things that I don't think could have been predicted was that there has been a lot of cooperation between the provincial and territorial governments and the federal government in Canada. And what I'm getting at is that the provinces that are controlled by conservative governments have been relatively well behaved in that they haven't used it as a lever to kind of create conflict between the government of Canada and the provincial and territorial governments. So that alignment's been important in Canada. There are differences province by province in terms of what happens on the ground. But generally there's broad consensus in Canada around some of the things we need to do if it's actualized differently. In terms of homelessness, in addition to the funding, the federal government has started to signal more through its investment and supports an interest in the prevention of homelessness for the time being. That isn't generally a core central part of the government's agenda at this point, but it's a promising thing. And I'm mentioning that because they're going to come back to prevention at the end. And those of you who know me should not be surprised. Just this week, we had an announcement from the government of Canada about a new investment, $1 billion for a rapid housing initiative. That doesn't mean rapid rehousing. What it means is for the building and purchasing of properties for the purpose of developing affordable housing. And so that's a good investment. I just want to state, though, that after 30 years of disinvestment and loss of affordable housing stock in Canada, we have a lot of ground to recover, and it would be very expensive to make up that ground. At the same time, they also invested an additional $237 million in our homelessness strategy to focus on supporting the work that's happening in communities across Canada. So that's just a brief overview of what's happened within the government. There have been other investments that impact. They've done a lot of work supporting sectors and industries. Going forward, one last thing is that some sectors, this would be true in other countries, some sectors have been affected much more significantly than others. The service industry has been pretty devastated. A lot of employment that women are more likely to participate in has disappeared. So there's been an unequal impact of the pandemic on the economy. So municipalities and communities respond. There are some challenges here that we all know, and people have spoken about. Our institutional response to homelessness produces vulnerability during pandemics, and we've known that for a long time. And every pandemic that comes forward raises these issues again, like basically warehousing people, as Dennis remarked, Dickensian poorhouse models of providing supports for people have been in place for a long time. Public health measures make underlying assumptions that everyone is housed. So things like make sure you wash your hands daily and isolate and these kinds of things presume that people have the ability to do these kinds of things. And one of the things we've seen in Canada, and so Dennis, your chart around the increase in unsheltered, particularly in the West Coast, is interesting. We've seen across Canada an increase in the number of encampments. So people living in tents, and this is right across the country. It's not that these encampments didn't exist prior, but the level and scale of it seems to have been increasing. We don't really have a handle on it. It presents challenges because one of the key responses to homelessness in Canada is the use of law enforcement. So the encampments, can result in a positive response to the needs of people, or it can be a negative response. And it shouldn't be surprising, I guess, if it was me that was faced with going into an emergency shelter or living in a tent, I most certainly would choose the tent. Now, so these are the kind of things that have happened, but one of the things, and this seems to be true in other countries as well, based on the other presentations, while we predicted higher rates of infection and death, we haven't seen massive outbreaks in the shelter system. We do see them. I don't want to say we haven't. And in fact, the per capita deaths are higher amongst homeless populations, but it hasn't swept through the shelter system in ways that we thought. And at the community level across Canada, we're seeing innovation responses. There are some communities where they only have a couple of shelters and now they're shutting them down because they managed to house everyone, which begs the question, what were we doing before the pandemic? That kind of thing. So we have different things in different cities. There's been efforts to communicate between municipalities and communities. The movement of people into hotels, which we've seen in the other presentations, is pretty common. Shelters have reorganized themselves to allow for spacing. still leaving the problem that even if you have space between cots or barriers, there are still people moving around all the time. And so that ability to isolate and social distance is compromised. I'll talk a bit about the City of Toronto and its response. Toronto is Canada's largest city and has the largest homeless population. You know, I think the last point in time count was around 8,000 people. It has the largest shelter system with 75 different shelters and respite sites. Well, there's the number, 7,000. And the city has implemented an intergovernmental response to COVID-19. And so here are some of the things that the municipal government reports. So they've made efforts to mitigate the risk of the spread of the pandemic. So you know, more guidance around prevention, infection prevention and control, more screening, but not across the board. They haven't implemented that every person in every shelter gets tested. They've implemented some isolation programs, recovery programs, et cetera. Some people have criticized them for not having a robust pandemic plan. Having done a lot of research on pandemics and disaster management, plans are important, but these kind of crises are highly unpredictable and often dependent on the characteristics of the infection and how it spreads and that kind of thing. So I think communities have, you know, done in often cases really good job of responding to something that they weren't prepared for and couldn't necessarily be well prepared for. City has also been working to rehouse people. This is a report from the city. And this was in August. So they moved more than 1,900 people who were in shelters into 18 hotel sites, created more spaces for people in community centers. They've moved more than 500 people from encampments into interim housing and more than 1,300 people through rapid access initiatives to get housing. The city is, of course, grappling with the question of what happens when that funding runs out. What are we going to do? Do we return everyone to homelessness, or do we find permanent housing for people? The additional investment by the government of Canada may help push back some of those needs to address that, but it's an important one. So on the ground, just keeping track of the time here. Okay, I'm going to try and move this quickly. So we did a couple of consultations with people working in the youth homelessness sector across Canada. So I don't want to just focus on Toronto. And so we've put out 2 reports in terms of what people are saying is happening on the ground. There are lots of side effects of the pandemic that impact on the lives of young people and adults who are homeless. So staying home and self-isolating when sick is, of course, more feasible when you have a place to live. Social distancing is highly problematic. Washing your hands frequently, difficult. Many day programs have been shut down, so people don't have access to contact, to support, to food, things like this. Many of the ways people make money in the past, informal economic activities are no longer viable. Panhandling, there's still people doing that, but I don't know what it's like in other countries, but we've moved to a cashless economy quite dramatically during the pandemic. Accessing government benefits is challenging for many young people because there's a requirement that you are registered with our tax agency, and also that you've had some kind of employment in the formal economy in the past 12 months. And of course, many young people haven't. Providing harm reduction support has been very challenging. And because many people are isolated, the word we're getting, and we don't have data on this, but the impression of the service providers is that they're seeing a lot more overdoses and deaths from that. So we haven't got a good way of dealing with that. One of the things that we've done in Canada, it's now been lifted, but will likely come back, is do things, use law enforcement to make sure nobody uses public parks. or congregate in, small clusters. And of course, if you're homelessness and living outside, that exposes you to more attention by the police services, that kind of thing. So these are all kinds of things that are happening. The ability of the service providers to provide case management support to young people who are either in shelters or were in shelters, or are in housing programs like Housing First for Youth or these kinds of things, or are precariously housed, has been seriously undermined. Many young people who are precariously housed and are vulnerable to homelessness and are staying with their parents, for instance, we all understand that the isolation has exacerbated, domestic stress and violence. And so people are more vulnerable. We are hearing that the mental health of young people has been quite compromised, and there's a perception that there's been an increase in drug use. And as I mentioned, sometimes that can be leading to death. In spite of the moratorium on evictions, a third of the service providers say they're seeing lots of young people who are getting evicted anyway, right? A challenge for young people is sometimes their eviction is informal because their name isn't necessarily on the lease, but they're staying somewhere and they get evicted. So the systems aren't quite as airtight as possible. One of the changes that's happened is that the use of technology has facilitated outreach and engagement with young people, and in some cases in positive ways. And people have seen like higher rates of showing up for meetings because people don't actually have to go across town. They can just get on the computer. But the other side of that is that there's a significant percentage of young people who don't have decent access to technology and or are living in situations where they don't have privacy. So they can't, pull up the screen and talk to their case manager, that kind of thing. So the inequality in terms of access to technology is a big factor. One of the things that's changed is outreach. The organizations are focusing much more on outreach and doing, everything from bringing food to, trying to do harm reduction to counseling, that kind of thing. So what happens next? I only have a few minutes, so I'm going to try and go through this. Now, in the recovery, and we're not near a recovery, the numbers in Canada went down in the summer, but we're seeing an increase in Canada. I know we are in the United States as well, and in Europe. So recovery isn't straight ahead, but some of the things we have to think about is like what happens when the taps get turned off, the funding. Will there be a return to austerity and cutbacks? The financialization of the housing market, will that accelerate in the way that it did during the economic crisis in the first decade of this century? Will there be a return to business as usual in the homelessness sector? Will we just go back to doing the same kind of things? And are we really prepared for what happens next? So all of these could contribute to homelessness. In the United States, this is a chart that Patrick Fowler from Washington University, St. Louis, showed me months ago, but it shows that in the United States, there's a reduction in evictions every December because it's the holidays, but that it spikes again in January, right? So whenever you have a moratorium, either official or unofficial, we're going to anticipate a spike in evictions. And are we ready for that? Same with, transitions from care, right? So people are aging out, but aren't losing their foster care or other kinds of supports right now. But what's going to happen when that gets lifted? Are we going to see like a surge? Because that system is in many ways designed to produce youth homelessness. But there are opportunities. So as the other speakers have said, COVID-19 has highlighted the folly of responding to homelessness by basically warehousing people as being our core response. Now, we do have to have an emergency system, and it needs to be a helpful one and a respectful one, but we have to do more than just warehouse people. But we're at a time when there is a possibility of unconventional responses by government. We're not in the situation in the United States where provinces and territory, or in the states where states are being starved for funding, and we have such polarized divide, right? So it's a chance for government to do some bold things, and there's already suggestion that they may go down the road of universal child care, these kinds of things. And so it's possible to do something really bold around homelessness. Canada now has a national housing strategy, but the funding is all backloaded. What they could do is front load the funding over the next 2 or 3 years and go on a major, construction spree to enhance our affordable housing supply. There's been talk about a guaranteed basic income in Canada, building on that benefit program, and the support for that in Canada has risen quite dramatically. We could implement measures to curtail the financialization of the housing market and prioritize, for instance, housing providers to purchase, buildings and these kinds of things. We have to aggressively move to address the housing precarity of Indigenous people. They make up 4.5% of the Canadian population, but over 30% of the homeless. And then finally, we can focus on prevention. And I'm going to wrap up with some questions for people. So many of you will have seen this diagram before, that there are 3 ways we deal with homelessness. We can prevent, we can have an emergency response, or we can move people sustainably out of homelessness with housing first programs, that kind of thing. And in Canada, the bulk of our efforts and expense are in that middle area, the emergency response. But I want to ask you, what if we responded to the pandemic in a way similar to how we respond to homelessness? What would that look like? Well, one can imagine we would start investing in expanding the waiting rooms of hospitals, come up with very flawed ways of prioritizing who gets to go see the doctor first. And we could basically ignore the problem altogether in a way. And, would that make sense? And here's the thing. We don't really do this, do we? Except maybe in places like Florida. We in fact take the prevention of pandemics very seriously. And we actually know that prevention works, right? So we encourage people to wear masks, knowing that is important. Attention to hygiene, cleaning surfaces, cleaning hands. People, social distancing, people are able to do that. People are isolating depending on the severity of the pandemic at that moment. Strategic closing of services has happened in different waves and different points. We had a lockdown in Canada that was fairly total, not every business, but a lot. But, should we have bars open, movie theaters, this kind of thing? And we are anticipating the development of a vaccine. So in responding to the pandemic, prevention is front and center alongside ensuring we have that emergency response with hospitals that are able to meet the demand. And in fact, the prevention is seen as key to ensuring that the demand doesn't override the supply of support for people. So let's ask another question. What if we treated homelessness as a pandemic? What would it look like, right? Because we've designed our response as a crisis response to an emergency, but we aren't really dealing with it as a pandemic. If we truly want to address homelessness we have to stop treating the response in the way that we're doing, which is that emergency response, and at best, waiting for people to get sick enough or old enough or be homeless long enough before we provide them with housing. We need to shift that focus to prevention. We need to really figure that out well, and invest in it and target it and do that well so that we can come around to something that looks more like this, right? Where we have a more balanced approach to the response to homelessness. And it's possible, Ruth, your presentation was interesting because the conversation around prevention seems to be there. Dennis, your presentation suggests that in the US, the conversation is happening, but there's nothing that suggests that there's going to be a policy shift in that direction, maybe the opposite. So anyway, that's my presentation. Thank you very much.
Thank you. Thank you, Steve, for your speech and for your final challenging proposal. I thank again our three speakers for their significant presentations, which explored from different points of view the theme of the homelessness in this viral age. I have seen many questions flowing on the chat, so I think that we have materials enough for our questions and answer session. Nora, are you still there? Would you mind chairing this session?
Thank you so much, Marco. I think I will be the one who can sum up those questions that Ruth was addressed by. Specifically, she got 7 different questions to answer. Both of them are pretty complicated. So Ruth, in the meanwhile, I was trying to pass them on to you. So I think let's start with the one which is about the expectations, how homeless people would be affected by COVID. And then it turned out that particular condensed difficulty did not appear actually within the service provision system. But I will actually let you elaborate on that, and then maybe you could just make use of the other questions responding time as well. Okay, thank you.
Yeah, sure, thank you. I mean, I think the reality is that certainly at a European level, and even within the different European countries, the detail on infection, on deaths, even on hospitalizations and intensive care admissions, and how people fare if they get the infection for homeless people is just not, it's still not very documented, it's still not very clear. As I mentioned in my presentation, there are some indications that the levels of infections and the levels of deaths are way lower than expected. We don't really understand why. I mean, some of the work that I mentioned in my presentation ascribes that quite quickly to the effectiveness of policy response, but it's maybe kind of early days to do that too confidently. I mean, I think some of the understanding of the disease that's evolving very quickly in terms of the importance of indoor settings for transmission is relevant in terms of understanding this, how it goes forward. But I'm afraid I can't give contagion and death rates for Europe. But as you say, some of that early evidence is that it's not ripping through the homeless population in the way that people thought it would. And then there's all kinds of interesting ideas about why, even if they get the disease, homeless people don't do as badly necessarily as predicted. Some of them to do with, I don't know, like, you know, really mad things that we don't understand yet about the potential protective effect that smoking can have, for example. So I think a lot remains to be understood. In terms of the next question that was sent to me was about how did public authorities communicate with homeless people about the pandemic and about the solutions that were available, or the services that were available to them. I mean, I think it was quite old-fashioned communications outreach in many countries, like leaflets, posters, videos. Outreach teams played a really important role. One of the things that in Europe was very important was having all of that available in lots of different languages, because of the increasing overlap between migration and homelessness and free movement and homelessness. How can we ensure that COVID-19 is a kind of turning point and that people don't return to the streets? I guess that's the $1,000,000 question. I wish I knew how we could ensure it, but I think we have some good ideas as advocates about, a lot of it's about continuing to make the case that we've made for a long time, and that COVID-19 has just crystallized that managing homelessness is inhumane and ineffective and costly, and progressively ending homelessness needs the kind of shift that Steve captured so well in his last slides. And I think I would agree with him that we're at an interesting moment, and also that was echoed in Dennis's presentation a little bit in terms of public awareness and sensitivity to these questions, partly because of the extent of the housing crisis that we were in even before the pandemic, and partly to people's experiences about what didn't work in the way we responded to the last economic crash, and partly to the way that the homelessness has been made very visible during the COVID-19 crisis. Somebody asked whether any of the measures that I talked about specifically targeted destitute EU migrants. So a really interesting question, and I think one of the maybe surprising things about COVID-19 was that in some instances, the pandemic made it easier for destitute mobile EU citizens to access services where public policy had deliberately excluded them from services. Like, you know, in England, the guidance to local authorities in the context of the Everyone In programme really pushed local authorities and promised funding, which is normally not allowed from central government, to include those people in these measures. And I've heard that access to benefits has been made easier in different countries. In the Netherlands, a lot of local connection criteria were softened or removed. But the question is, those measures are already being rolled back. Like, certainly in the English context, the central government is no longer promising to support local governments to cover those costs. And somebody asked, do I think that in maybe the next 3 or 5 years, the question of homelessness will become a big question for the general public? And I think probably I touched on that earlier with some of the comments about public awareness and sensitivity to these questions. So I think at least those are most of the questions that Nora grouped together and shared with me. The chat is so active, it's a little bit difficult to follow, so please feel free to tell me off if I've ignored something.
I think you did a great job. so those were at least directly addressed. Let me pass on the word to Volker. I have to unmute you. Sorry, Volker, just a second.
No, it's okay. I can.
Okay, good.
Okay, thank you. Hello, everybody. Some questions to Dennis. One very general question: whether racism has become bigger with the COVID epidemic. Another one: the hotel route. Do you think that is there any indication that homeless people or local authorities or NGOs are strategically using this route to get homeless people quicker into permanent housing, and are they really offered permanent housing after staying at the hotel, and who provides the support? Can you speak a little bit more about this this new kind of route out of homelessness? And one more also by Freek about the, do you have the impression, but that's a question to everybody, do you have the impression that health ministries are now more concerned about homelessness and might be new partners in the fight against homelessness? Edith.
Sure, thanks, Freek, or excuse me, Volker. I guess the first question about race I don't believe that we have any evidence that homelessness, because of the pandemic, is more disproportionately impacting African Americans, let's say, or Latinos. But we have known for some time that even controlling for poverty, people who are Black are more than twice as likely to be homeless than the general population. And but I don't know of anything that says that has worsened during the pandemic. But one could conceivably think that it might have because of the differential impacts on housing insecurity. With regard to the hotels and motels, I do believe that indeed several places have, you know, really focused strategically on seeing that this is a way to, you know, move people directly out of a homeless situation into housing, that the hotels and motels are like a better staging area for doing that. The case management is still coming mostly from the homeless assistance case management programs, but the provision of direct on-site health supports, including behavioral health supports, has brought in healthcare providers into these settings in a way that I don't think they would have been in the congregate shelter space. So I think that has marked a departure. But I was like mentioned that, you know, the state of Connecticut, for example, similar to what I hear in London, every person who is sleeping rough got placed in a hotel, motel. In the state of Vermont, which is not a big state, but they had 1,200 people in shelter. Everyone in shelter was moved into a hotel or motel. So yeah, there has been fairly deliberate efforts to sort of revision how to address those folks' homelessness. Whether this will persist into the future, I don't know. I do think that there's been so much talk about social determinants of health, but very few opening up of sort of the budgets within the health system to actually focus on, you know, exhibit 1 in the social determinants of health case, which is homelessness. And you know, but there are states that have sought waivers, most recently in Minnesota, and California is in the process of doing so, where they are trying to get permission to use their, you know, Medicaid funding to pay for housing relocation services, housing stabilization, and tenancy supports. And that has been approved in several cases in some states, and I think that will continue to happen. So we could see that there could be a health pipeline of funding to who, quite frankly, would probably be more qualified staff with better training, and they would have much more oversight, because the whole oversight of the way healthcare is administered and services are provided and their outcome focused would, I think, bring a better performance management structure to it than exists in homeless services. So I think there is a prospect that we're going to see more integration of healthcare delivery into the homelessness assistance and homelessness resolution process, which I think would be badly needed. I know we just did a plan for LA on how to house all the elderly homeless there, and it relies entirely on the case management and housing stabilization being paid for by the healthcare sector and provided by them. So I hope that helps clarify.
Okay, there were some more questions. One to everybody, also about hidden homelessness. Has the pandemic led to hidden homelessness being more visible? One question, and another question, which I actually don't really understand, but it's why is the National Alliance to End Homelessness opposed to prevention? Is it? I don't know. I mean, it might be a provocative question. I don't know.
The National Alliance is not opposed to prevention, but that the dollars that are specifically been allocated for homeless assistance under the pandemic should be spent on people who are homeless, because relative to the need for people who are housing insecure, the homeless population is a much smaller group. And of course, because they're literally homeless, they're at much greater risk. So the idea is that these dollars are specific to that, because just as an example, I think that while it's $4 billion is available for the homeless assistance, there's $100 billion that was given to state and local governments to deal with housing problems and rent arrearages. I mean, so that's the $100 billion that should go towards the prevention of that bigger population. So I think it's just an issue of which pot should be devoted to which group. It's not an ideological opposition to prevention. It's just that the research has consistently showed that people who get homelessness prevention assistance, only a tiny fraction of them would have become homeless without that assistance. So the people who get targeted with homelessness prevention don't actually become homeless absent that assistance.
Okay, Frick, do you want to take the questions from Steve?
Okay, I had to ask permission to be unmuted. Steve, like, feel free to maybe jump into to some of the issues that have been raised as well. There was also a specific question for you in relation to sofa surfers, because they're often young people. Has the increase in homelessness that you might see in Canada during the Corona crisis, is it related to the fact that for young people and older people, it's less easy to continue sofa surfing and they end up in shelter on the street?
There, I had to unmute. We can speculate about that, but we don't have good data on that. And so we don't actually know. It wouldn't surprise me if that were the case, that it's causing some increase, and that could account for that figure where the service providers are saying young people are finding themselves evicted, right? They may be using that language to describe situations where those informal arrangements are breaking down. So yeah, that's all I would be able to say at this point. We're doing a survey, a national survey. Well, we've completed it, but with young people who experience homelessness, and we've been asking questions about that, but we haven't analyzed the data yet. So hopefully we'll learn something.
It's a bit complicated with unmute, but if you,
yeah, a couple of buttons.
Yes, indeed. No, but if you want to jump in on some of the other stuff that was already raised, issues that concern also Canada, that have been answered by Ruth and Dennis, feel free, Dennis, Steve.
Yeah, no, I don't have anything specific. I think, you know, Dennis's comments on targeting of prevention are important, right? Like we have to spend wisely, but I think we're learning a lot about that. I think the work done in New York City is quite interesting, where they've shown a way, if you assess properly and target, that you get good outcomes. But yeah, I haven't got any comments on the other questions.
Volker, do you allow me to ask a question to Dennis still? Just to abuse my power of being unmuted by somebody out there. Dennis, I was very interested by your, I don't know if I interpreted it right on the slides or what you said, but this idea that hotels can be now an easier transfer into permanent housing solutions than the shelter system. Is that really a thing? Like, do you think that public authorities, local authorities, homeless people are using that route strategically to get to a quicker permanent solution?
Yes, most definitely. And you know, the word is from the field that, you know, first of all, the clients themselves are much more stable when they're in the hotel than if they're having to bounce around through meal programs and, you know, nighttime shelters and walking around all day on the street. And that, you know, the case managers and healthcare workers know exactly where to find people. And so the whole situation is better designed as a way to get people planning and working through whatever the issues are going to be to get to a housing placement. So yes, absolutely. And I think that is the game changer potentially. I would note, by the way, the National Alliance to End Homelessness came out with a strategic framework that they put out about how to look at the homelessness in light of the pandemic going forward. I would encourage you to look at that because it very explicitly talks about doing this kind of a conversion, moving away from the congregate facilities, closing them down, moving towards a more stable temporary accommodation approach where people can be connected to services and transition to housing. So that they've sort of already outlined that in that framework. I would encourage you to look for it. Maybe we can find it and put it in the chat.
I saw some more questions. One was about homeless families. Yes.
Ruth wanted to comment also.
Okay. Yes. Okay. First,
Yeah.
first.
No, I don't want to jump in on anyone else's question, but I had a question for Dennis, but also about hotels. And it was just to say, I mean, I think there's very much the same reflection going on in different European countries. And I rushed through the slide a bit, but I think Prague is a really interesting example that they're looking to get EU financing to buy the hotels they're currently using to have a sustainable supported housing kind of offer going forward. But I also have like alarm bells going off in my mind, because there are lots of countries in Europe with a long and troubled history of using hotels and B&Bs as a form of temporary accommodation, especially for homeless families with very poor outcomes. And you don't have dormitories, but you don't have private cooking and facilities, etc. And people end up there sometimes for a very long time. And then that's what you were saying about the stabilizing function of these places during the pandemic, and the critical element of the support work, and the fact that it's easier to do the support work and connect people to the next step in those settings also very much resonated. I think that's being found here in Brussels, for example. So I guess my question is, how do we avoid that hotels become the new non-solution and we repeat some of the bad experiences that we've had with hotels in Europe, and how do we use them like in a smarter way as a more transformative kind of step towards permanent housing?
Can I intervene for a moment, because the question on families is, I think this is relevant in that context. We had comments on hotels do not provide facilities for private cooking and so on, but I think it's a big difference to house families in hotels and bed and breakfast, or to have individual rooms for individuals. And perhaps the others can also dwell a little bit on the situation of homeless families. And another question to everybody is, do we know any studies about the experience of homeless people themselves, of their reactions to COVID-19? Are they scared, or are they saying, okay, I have experienced a lot of situations, this doesn't really shock me? Do we know anything about the reactions of homeless people themselves? Thanks. Dennis.
I don't know specifically that there's any reports out about reactions of people who are homeless themselves, but I mean, we have seen these encampments that, as Steve mentioned, there has been a growing number of encampments. I think it's partly because of the reduced density that has happened in the shelters, as well as people just don't want to be in these facilities. They think of them as inherently unsafe, like nursing homes without walls, you know. So I think that some people are, you know, very much, you know, afraid of going into the facilities. Here in Philadelphia, we have going on right now a 3 different site encampment protest going on. So people who are homeless have gathered together, not just as an encampment, but explicitly calling for it as a protest, police-free zone, insisting that they want, you know, and there are very visible locations. In one case, they're at the headquarters of our housing authority, and the other case, they're right in front of the Rodin Museum, which is, you know, on this, you know, parkway. That's a very visible location. So there has been some mobilization, actually, of people who are homeless around this as well, because it probably as much about the Black Lives Matter movement as much as anything, because I think that's very much inspiring activism across the board.
Okay, I will. Freek, do you want to pose another question on that? Okay. I'm pressing the button now. So
Yep. Okay. Wow. Complicated. I think there was another a few questions not addressed at anyone specifically, but those that want to answer can answer. One is a relatively provocative question, I guess, questioning also the role of hotels, especially for street homeless people, because it can be quite disrupting for them, and suggesting that maybe tent communities are a better alternative for these people in times of COVID. And then there was somebody asking whether these solutions during COVID, housing solutions or temporary housing solutions, if they also take account of homeless people that have pets, and what do they do with the pets of homeless people?
Whom do you want to respond? Prompt to respond. Who wants to respond?
Whoever wants to respond, whoever has the answer, I think is the easiest.
I have to unmute the speakers, so raise your hand. Okay. Steve? Takes a bit of time, sorry, yeah.
There, yeah. Okay. I don't know about that. It's a really good question. I mean, the using hotels and motels would, you know, of course, present barriers for people having pets depending on the rules of the hotel. But that's also true of the existing emergency shelter system. Hotels also present problems for people, like when there was a lockdown, you know, people who smoke would need to go outside, and when they were outside, they were hanging around other people and often were subject of police attention for that reason. So, you know, hotels, I think the way Dennis described them as a staging ground for moving into housing makes more sense than necessarily imagining that they're a solution, because they could be considered a good emergency response solution, but I'm not sure about permanent housing. In thinking of the hotels, there was a question asked before about the relationship to families. So many communities in Canada have used hotels for families for a long time. And in Toronto, we do that. And at some level, to me, it's another form of warehousing for families, because it's you know, the motels are on the east end of the city. It forces families to be dislocated from their communities of origin, where they lose the benefit of natural supports that they might have in those communities. Young people lose their school that they were at and now have to go to one near the motels. And those schools, we know from, I know from research, I had 2 students do research on that. The schools are not totally receptive to the young people who are living at the family shelters, because they don't expect them to be there that long. And so I think they get an inferior education experience. So, so that you know, along with the fact that they don't have separate cooking facilities, that kind of thing, or necessarily other kinds of supports that would be helpful for families. I don't think we want to see that as anything but a form of transitional housing at best, with a guaranteed exit to some kind of housing solution, yes. I would argue.
It would have to be managed. I would just note, by the way, I didn't mention it, but I think that at least half of the hotel acquisitions I'm hearing about, they're talking about going in and putting in kitchenettes, so that these would become permanent housing, like more like SRO, you know, single room efficiency apartments. They're not all being designated as emergency. And in fact, California just announced a plan, and they distributed the first $80 million of it, and there's going to be 700 million, which is for conversion of the hotels into housing. So it's a bit of a different strategy.
And that's happening in Canada as well. Mm-hmm. With the new rapid housing investment, it's to, you know, cover the capital, not just for the purchase of, say, hotels and motels, but also for refurbishing them so that they're discrete units. And I think you're characterization of them as SROs is pretty accurate, right? And that's not a bad thing, because I don't know if it's true in the US, but we've seen that kind of housing, which wasn't always very good. There's often exploited, but we've seen that type of housing disappear in many communities across Canada. And that housing in some communities was used for temporary workers who were moving to a place for employment but didn't want a full-on apartment. And in many, with the absence of that kind of housing, many people who are employed in places like Alberta, where they have a boom-bust economy, many people who are in the homelessness sector are employed because there is no housing options outside of that. So I think that those are important developments, right? Like we could look at that in a positive sense.
I think Steve, on the go, you have answered a couple of questions that were popping up in the chat. So thanks for that as well. But there are like two issues which we have not yet addressed, and you might add further questions, Freek and Volker, if you could just spot those. There was one issue which I also wanted to raise, which is the postponement of the evictions and those great figures, Steve, that you were presenting. So there may be a huge influx later on. So what can be the responses to those families or individuals becoming homeless? Actually, this will happen beyond the COVID crisis with them. So what are the thoughts? So that would be one of the issues. So I'm directing this question to you directly. And the other one, which is a more general one, what's happening with the criminalization of homelessness in these times? I know it's a complicated issue, and there are very different contexts within Europe also. So there's a huge variety. But if you could also reflect on that, what is there, that would be helpful.
So maybe we can just.
So now you can start talking freely, hopefully.
Yeah, and maybe just add the third one, so then everybody can take one of the questions. It's a question about not COVID deaths, but COVID-related deaths amongst homeless people, like increasing suicide, for instance. Is that an issue you have heard about in your country?
Okay, Nora, can you remind me again what the first question was? I only started writing them down at the end.
Okay, so there is going to be a great influx of people into homelessness because of the evictions.
Yeah, so we don't actually know what will happen, but we can presume. I think we're getting better at targeting supports, and the supports aren't necessarily just financial, right? It can be like in Canada, depending on the province, the evictions process, the official process, involves numerous steps. Along the way, there could be an intervention that could help, a legal intervention, for instance, or it might be financial, different things. We've invested very little in evictions prevention in Canada. And one of the things that's always struck me is like, there's a public, well, I wouldn't necessarily say it's public, but there's a record of who has been served notice of eviction, right? So like we actually know who's sitting on the bubble. And so if we were to use effective targeting and provide supports, we could mitigate that potentially to some degree. And that could be a helpful, and it sounds like, Ruth, in Europe, some of that kind of thing has been going on. So I'd like to see that. There's the aging out of care thing, I think, is completely ignored. Certainly people working on the issue are focusing on that. But that's another one where we could have a big influx of people. I think the early intervention prevention, evictions prevention could be helpful too, because in these times, right now in Canada, we haven't seen a decline in property values necessarily. There's some suggestions, some communities' rents are declining in price, but it would always be in the interest, or not always, but mostly be in the interest of a landlord to keep a tenant as long as they're not, causing harm to the property, rather than have to get a new one. So there might be possibilities there. In terms of policing, we don't know. In the survey that we did with young people, we asked some detailed questions about getting ticketed for, you know, by the police for being in public spaces or things that they determine to be related to violating the lockdown measures, that kind of thing. So we'll find out a bit on that. I always presume that unless we know evidence to the contrary, if something existed before the pandemic, there's a pretty good, you know, probability that it's still happening. You know, so like, you know, the racist activities of police, which happen in Canada as well, not just in the United States. I have no reason to believe that that's diminished because of the pandemic. The pandemic may have produced conditions that exacerbate it. And so the same would be around criminalization of homelessness. I think the existence of encampments is going to really push that to the fore. And it will depend on the community. Not every community criminalizes homelessness in the same way. I think Toronto in Canada has stood out as using law enforcement a lot over the years to deal with homelessness. But we don't have actual data on that. So, you know, that remains to be seen. There's all these areas, you know, data deserts that we have where it'd be great if we had like real-time information, but we don't.
I would just add, we have seen, you know, there's been a decarceration movement going on.
Yes, that's true.
And, and that accelerated with COVID because the risk of people in local prisons and jails. And so there was some reduction in prison sentences. And there, you know, has been also policy changes not to arrest people and not to incarcerate people for minor violations, which I think has had a big impact on the homeless population. So if we are seeing a reduction in the criminalization of homelessness, I think, in many places where those policies have been adopted.
Are they reducing the ticketing? Because that would be a major thing, which leads to debt. And in some cases,
I don't know the specifics of it. I just was recently involved last week in a conversation in Denver where, you know, they imposed this policy and arrests dropped dramatically among people who are homeless because they basically said, we're not arresting people for these things and we're not going to put them in jail. I just don't know how, you know, you can't generalize the whole country based on that, but I'm just saying that.
That's interesting. That's good.
Maybe just to jump in again on the evictions front, I think, like, yes, we can respond to a massive influx of people into homelessness, but it would also be good to do everything we can to avert a massive influx of people into homelessness. So I think, like, you know, maintaining some of the measures that have been put in place in terms of stabilizing people's incomes and reducing or you know, keeping in place, at least for the duration of the pandemic, these moratoria on evictions, and trying to address in a more assertive public policy way the issue of rent arrears. Like, you know, European governments and governments around the world have done things that we might never have imagined them doing in terms of absorbing some of the hit from unemployment. And it's not unthinkable that they could do some of that in the area of rents. We've seen some of it in Europe in this phase of the pandemic. In France, some cities have used the Solidarity Fund, that is a kind of contributory fund to cover rent areas that exists for a long time, to specifically cover areas relating to the pandemic and the sort of targeted rapid response things that Steve mentioned. There's some very good and very well established practice. Like in Vienna, they have a system, like you mentioned, where every notice of eviction is followed up with a kind of tenancy support offer. And I think more generally, there's a kind of movement around what in Finland is called housing social work. And we'll see a big role for that. And we should also keep and expand measures that block well-known pathways into homelessness, like the eviction from asylum centres, discharge from youth care, that have been put in place during the pandemic. In terms of the criminalisation, I mean, it was a big issue for Fianza members at the beginning of lockdown to try and monitor and to try and prevent homeless people being disproportionately penalised for not respecting lockdown measures because they couldn't stay at home. And I think we've seen both good and bad practice in relation to that. Certainly it's pointless to fine homeless people because they're not staying at home. And maybe in relation to the question on suicide, I mean, I think it's an issue for the general population, the impact of lockdown and the kind of related isolation and loneliness that we're only really beginning to get to grips with in terms of the mental health impact of this pandemic. I think some of the like harm reduction type approach that I talked about in Dublin, there's some interesting bits of good practice there in terms of just making sure that if you push very vulnerable people to shield and provide them with somewhere to do that, you have to provide enough follow-up calls, visits, drop them off their medication, do everything you can to keep them safe in that place, to prevent serious mental health problems and suicide related to social isolation. Yeah, so those are just some thoughts on questions.
Right. I think we have 5 minutes left, so grasp the opportunity to comment or pose a last question. Volker, Freek, Dennis, if you wish. Marco, please.
Well, I think that the NAEH framework, and by the way, it was done with other people, and I put it in the chat box. There's a link to it. I think it's the right direction that in each of our countries and respective jurisdictions that we should be using this opportunity to, explicitly frame up what are the values and the goals and that we want to accomplish. The homeless system in our case is just a patchwork of charities with occasional public policies slapped on them, and it's underfunded. And, I mean, more than half of the adult homeless in the United States actually have no shelter bed to go to. It's not even a reasonable safety net, to call it that. So, maybe this is an opportunity for us to say, okay, we have these unhoused people, and what is the strategy to get them housed? What's the systematic approach? Not accepting that anyone should be parked in any warehouse for any long period of time, but that there's just a professional approach to doing the social work, the housing social work that, resolves people's circumstances. And it just seems that's an opportunity.
Can I just take the last 2 minutes to announce that the observatory is working at the moment on collecting evidence on the consequences of COVID on homelessness in Europe, more evidence as we already have, and we will follow on to have another webinar where we present our results towards the end of the year or the beginning of next year. And just to say a big thank you to our 3 speakers for presenting here and for raising a lot of interest, obviously, among a lot of participants, and all the participants for being patient with this type of digital conversation. You get some of the questions answered in the chat section. And thank you very much. And I think we have 2 more minutes. Marco, do you want to close, or are you still there? I don't know.
Yes, I'm here, and I'm really happy with this meeting, which was really interesting. I think I thank again the speakers for their speeches, and I believe that their words will help us in research and action from here until our next appointment, which I remind for the last week of September in Bergamo. I thank also all the attendees for their questions. And I thank again Fianza, Nora, Laura, and all the people who worked to make this event possible. Thanks to all. A warm greeting to all. And see you next year here in Bergamo.
Thank you to all speakers. And Dennis, good luck with the elections on the 3rd of November. We hope that we can welcome you in Bergamo with another president.
Bring them along.
I second that.
Thank you.
Okay.
Thank you. Bye-bye.
Thank you.
Thank you.
Okay.
Bye-bye.
Bye.
Bye.